Good evening, everybody, and welcome to tonight's class where we will be talking about pregnancy and chiropractic and why it is so important that you get checked while you're pregnant. So a lot of people ask me, well, why do you care? You don't have kids, right? I may not have children. That is very, very true. However, I have nieces and nephews. I have a lot of friends and family that have kids. And so because of that, I want to make sure kids start out on the right foot, so to say. And the best way to do that is to make sure that in utero, they are doing very, very well themselves. So when we look at adjusting mom, it's for a couple of reasons. One, we want to make sure that the baby's environment is as it's intended to be, so that the pelvis is relaxed, that the pelvis is not shifted, contorted, or what have you due to subluxation. So what is subluxation? Well, if you've been watching our classes, you should be able to recite what a subluxation is very, very well. If this is your first time, well, let me explain. A subluxation is a misalignment that happens in a joint. Now, if we're talking about the pelvis, we're talking about something like this, okay? This happens to be a male pelvis. However, if we're talking about the pelvis, it could be that it's tilted. It could be that it's rotated one way or the other. It could be numerous different things. Well, there's a bunch of muscles in there called the pelvic floor muscles. And that's not their individual names. It'd be things like iliacus and piriformis and psoas and things of that nature. However, the pelvic floor muscles are what help to support the baby, as well as what helps to control how the pelvis moves or allows it to stay in a proper position. Well, you see, during pregnancy, if we're subluxated, if the pelvis is not moving well, then the pelvis doesn't expand as it is supposed to during the growth of the child. And inevitably, we end up with kids in a breech position. It's amazing, and I need to look at this study, and I haven't found it for a while, so I'm going to have to look it up. But it's a study that I actually read and researched in college, and it showed that, I believe it was Blue Cross Blue Shield Mesa Edition, or Mesa Division, if you will. So the Michigan Education School Teachers School and Staff Association or something like that. I don't remember exactly what Mesa stands for. But it was either that or one of the higher level Blue Cross. And they did a study of, I believe it was, so it had to be bigger Blue Cross, but I believe it was like 20,000 pregnant moms. And half of them, they had chiropractors adjust. Half of them, they just followed through their birth process. And what they saw was absolutely cool. The vast majority, I think it was something like 99%, were able to carry their babies to full term. I believe there were only 2 or 3 necessary cesarean sections. The vast majority of babies were able to be born naturally. So why is that important? Well, if mom's going to have a C-section, there's a lot more medications that go in, and they are pain-blocking medications. Well, pain-blocking medications cross the blood-brain barrier. If they cross the blood-brain barrier, that means they can cross the placental barrier. And that means they're not only affecting mom, they're affecting baby. So if we're able to adjust and help to relieve the stress on the pelvis, help to reduce the amount of breech presentations, if we're able to allow mom to relax easier, then baby goes into the vertex position. They go to what's called head down or vertex, right? And they're able to be delivered a lot easier. Now, does that mean that emergencies don't happen? No, of course that doesn't. Does that mean that chiropractic is the end-all, be-all, cure-all for, pregnant moms so that they don't have complications? No. means that if you are pregnant, getting checked and making sure that your pelvis is aligned appropriately gives you the best opportunity for the easiest birth process. It's amazing what can happen. It's amazing what can happen if you take away the interference from the brain to the body and the interference from the body back to the brain. It's amazing how the body is intended to do what it's supposed to do and does it well. That's what we do here. We help reduce that interference. We help moms, we help babies, we help elderly, we help the average Joe. Anybody who walks through our doors, I do not care who you are or what you come from as far as in your life, we are here to help you achieve your best, whatever that may be. If you're pregnant, well, that usually means that you've got a lot, and especially if it's your first pregnancy, you got a lot that you probably don't realize your body's going to do. And one of the main reasons for that is something called relaxin. I kind of briefly talked about that earlier. What relaxin is, it is a hormone that releases throughout the entire body, and it allows the ligaments and tendons to stretch or relax a little bit. And it allows that pelvis to then open up, and it allows the baby to grow without causing mom to break or crushing the baby as it grows. So think about the square watermelons in Japan, or the skull-shaped peaches, or pears rather, that are grown. Well, how do they do that? Well, when it's very, very small, when the fruit is small, they create a cube for the watermelon, or they put the pear into a closed plastic, and it's a very hard plastic container that's bolted shut. That way, when they grow, it has no other choice but to push against those areas, and where there's less restriction, it grows into that. And when there's more restriction, it stops growing there. Well, think about that. Think about if your pelvis wasn't allowed to move, then babies would probably have some deformities. Some of those might be permanent. Some of them may not. And I'm not trying to scare you. I'm saying if your body wasn't able to move at all, that's pretty scary to think about. Now, the vast majority of pelvises can move, maybe not as ideally as they should. So that's where coming in and getting adjusted will make a huge difference. So I, as a doctor of chiropractic, have taken care of moms for, I don't even know, somewhere around 15 years. And I wrote my senior thesis on pregnant and nursing moms because of a patient that I was taking care of. When I was doing my student rotation in or my what we call the outpatient clinic, I was in the neurological unit and in the pregnant and nursing moms and kids unit, so the pediatric and pregnancy unit. And I worked with a lot of pregnant moms, and I worked with a lot of neurologically challenged kids and adults. And so that's kind of a passion of mine. And I want to help everybody start out correctly. So that's why it's so important to me to do this. That's why it's so important to me to give information about this. Now, what happens if you come in and you're, let's say, 6-8 months pregnant, and you're having a lot of low back pain, you're having a lot of knee pain, hip pain, it's hard to breathe and all of this other stuff that I hear all the time. Well, commonly getting adjusted does seem to help that. And it helps that because it relaxes the pelvis. There's a technique that I am proficient in, that I've trained in, called Webster's in utero constraint technique. It used to be called Webster's breech turning technique, and now we just basically call it Webster's technique. Okay? And what that does is we move the pelvis and the sacrum. We adjust those to help relax the pelvis, and then we work on the ligaments of the uterus that are usually, because of the pelvis being contorted, the ligaments are in spasm. And so we work those ligaments to relax, and lo and behold, the pelvis relaxes, the uterus slips back into a normal position, and the baby decides itself to turn head down. Anybody who has ever been pregnant and had a physician physically turn the child or the baby or the fetus in the womb, it is extremely uncomfortable. What we do is extremely comfortable. There is a little tenderness when we're working on the ligament. Think of having like a little bit of a muscle spasm and kind of digging in. It's going to be a little tender there, but it is never as tender as being maneuvered for the baby to be maneuvered vertex. And this actually, it's really cool. So what happens is after 1 or maybe 10 or 12 or so many adjustments, the baby ends up turning and going vertex on their own. And moms usually really freak out with this because the baby goes into the most movement they've ever felt in their entire pregnancy, followed by almost absolute silence. And so moms get freaked out, right? Huge earthquake in the belly, followed by quiet and calm. Well, the reason why is the baby's kind of doing a somersault, yelling out hip, hip, hooray, I can finally move, and then kind of settles in for a long uterine nap. And so it gets very quiet because now it's in the position that it is most comfortable in. Think about coming home, and I'm sorry we're going to go here, but think about coming home after a day outside playing on the snow or helping the kids outside, and you're really, really super cold and chilly, and you come inside and you have that nice hot cup of coffee or tea or cocoa or a hot toddy if that is your thing or whatever, curled up under a blanket with a fireplace, just the fire roaring in the fireplace, and you, and many of you, right? I'm right there with you. And that's exactly what the baby's doing too, because they're finally, after struggle, they're finally comfortable and calm. It's amazing to see this happen. It's amazing to help moms with this. And I am more than happy to help you or your friends or your family with this. Because let's face it, there's so many people out there that struggle through their pregnancies that don't have to. Now, can chiropractic help every aspect of pregnancy? No. And a spine that's aligned is far superior to a spine that is not. You know, someone once told me, and I love the phrase, anytime we take pressure off of a nerve is always going to be a good thing. And I cannot agree more. So think about that. You have a developing child that is being pushed on and pressured in not the right ways. And we can help your pelvis relax to allow that baby to not have the pressures put on them. I don't know about you, but that sounds like a win-win for me. So if you know somebody who is pregnant, if you are pregnant, if you do not have a chiropractor, give us a call. I will gladly set up a consultation for you. Give us a call at the office here. We are open this week, tomorrow, all day, but we are going to be closed Thursday through the weekend. We have appointments next week as well. The sooner you get in, the better it's going to be for you and for your baby. And if you're referring a friend or family, tell them about us. Let them know that we work with everybody from birth to well over centenarians. We are happy to help you in any and all ways that we can, as well as not just your spine, but helping you to not need our help. That's what we do these classes for. Yes, we do them to educate the public, but we also do them to help you so that you don't need as much help in the future. So give us a call if you know somebody or if you are somebody who is pregnant that needs their bodies checked to see if subluxation is causing issues. And if you are not in our area, call your local chiropractor and ask. Not all chiropractors work with pregnant and nursing moms. Not all chiropractors work with babies. But we do here at My Family, because we want to be able to take care of your entire family. So I wish you all a beautiful evening. There's our alarm. I hope you all have a fantastic week and an even better weekend. Keep in mind it is supposed to snow just this weekend, Friday and Saturday. Sorry, I know that's a 4-letter word for many of you, but it is a very, very pleasant word for Crystal and I. We enjoy it a great deal. So I hope you all have a beautiful week and a beautiful weekend. And if I don't see you tomorrow at your appointments, I will see you next week. Thank you very much and have a beautiful evening. Goodbye.